Hello and welcome to Lunch with the Editor. Today we discuss two extremely important issues. One is our cover story, the cover story of our current issue. This is about the medical devices scam that is happening all across the country. Stuff that is being brought in from abroad for as little as 10,000 rupees is being sold for 1.5 lakhs. That is, the patients are paying about 1,453% more for one particular item. This is knee replacement kit. So this is not just about the knee replacement kit, but across the board, several such implants, several such medical devices which are very crucial for various kinds of surgeries, various kinds of procedures are terribly overpriced. That is stuff that is the landing cost of a medical device is X amount. The patient is paying 1,000% more. So this is our current cover story done by my colleague Lola Nayar, who is with me here, who is joining me here, and she is going to explain this markup scam, this medical devices scam. Lola, please explain the scam in detail.
The thing is, we are depending on imports for 70 to 90% of our medical devices. That includes components for manufacturing in India. The government had set up a policy to encourage domestic manufacturing, which hasn't taken off because the people who have brought in investment or foreign direct investment have opted to rather import their products into the domestic market on the plea that the domestic market is not big enough, which is actually a fallacy, because in India the demand for medical attention is growing phenomenally. A classic case could be a hospital chain declaring 1 billion as its revenue this year. The margins in devices is starting, say, 200% to more than 2,000% also.
200% to 2,000%. This is unbelievable. And we have a government body, National Pharmaceutical Pricing Authority, which is supposed to look at stuff which has something or the other to do with drugs and medicines. Here, these medical devices are not even categorized as drugs.
They are not even categorized. Only 23 have come in, but only 4 have been put under.
Just 4 out of 23. That is how they have a free run.
Yeah, and there was an effort last month to get input or total data on the remaining 19 devices. But somewhere the manufacturing companies and the importers managed to nix it. With the result, now the government will no longer be getting the input on how much, at what price are these devices being imported into the country, and at what price are they being marked to different people.
If they are bringing in some device for 10,000 rupees and if they are selling it for the ultimate customer or consumer, which is a hapless patient, so that means that, you know, this 1,40,000 or 1,30,000 rupees that is in between, the margin, the so-called margin, so that is getting distributed all across the chain?
Yeah, see, the only justification at one point would be the distributor, because distributor has to store these things and he has to put in an import because he has to ensure till it is sold to the ultimate customer.